Hello and welcome. My name is Javier Carlin. I'm a doctor of physical therapy here at Renewal Rehab in Largo, Florida. And what we do is we help people who are dealing with a nagging injury get back to doing the things that they love to do pain-free without relying on painkillers or risking unnecessary surgery. So in this video, what I want to do for you is I actually want to show you the three main reasons that people have low back pain. Now, there are several other reasons for why you may be experiencing low back pain and stiffness, sciatica, or any other symptom that involves the low back area. But today I want to go over the top three that we see here at Renewal Rehab. And really, what I want you to know is that there are so many factors that play into low back pain, and there are so many different things that you can do. What I want you to know is that one of the worst mistakes that you can make is actually looking for random exercises, random stretches on YouTube. The reason that is one of the major mistakes that people make is because with therapy, there are different phases of rehab, different levels that you have to achieve before you move on to the next one. So by doing a random exercise that you might not be ready for, you might actually hurt yourself even more. And that can be very, very dangerous. There's a progression to this. There's a progression to how your muscles heal, how your tendons heal, how your ligaments heal, how your cartilage heals. All of these different connective tissues that we have inside of your body that I'll be showing you now, they all have different healing times. And if we do some inappropriate movement or an inappropriate stretch or an inappropriate exercise for that stage of healing, you can actually hurt yourself even more. So I plead you that as I go over the three main causes of low back pain that we see here at Renewal Rehab, I plead you that you don't search for how to fix low back pain because of stenosis, how to fix low back pain because of a herniated disc, how to fix low back pain because of a piriformis syndrome. If you feel like you're struggling with any of these things, any of these symptoms that I'm about to explain to you, go seek a healthcare professional, go get their advice. Right? Reach out to myself in the comment section below, and I'll be more than happy to connect you with someone that's trusted that'll help you in solving your problem. Whether you're local here in the Tampa Bay community or whether you're located somewhere else around the world, please feel free to reach out. Please feel free to get expert help for your solution, for your specific solution. Okay? So let's dive into it. First and foremost, I want to go over stenosis. And what stenosis is basically a narrowing of the canals of the vertebrae. Now, what does that even mean? So essentially, over time, as we age, and with different lifestyle factors and different lifestyle stresses, our discs, which, let me go ahead and show you what the discs look like. Our discs that protect and cushion our vertebrae actually start to lose their ability to absorb shock. They also start to get thinner and thinner. So what happens is that because these discs right over here get thinner and thinner, the nerves that run through these vertebrae, which we call the foramina, we have a lot of nerves. So let me just go ahead and show you the first layer. So the nerves and the nerve roots that run through these holes here, they can, because they're starting to narrow, they can be irritated and they can be compressed. And when that happens, you have pain. Now that pain leads to muscle spasms. That pain can lead to a sensation of a shooting pain, shocking pain, burning pain, numbness and tingling. There are several symptoms that can happen because of this nerve compression. Now, the fact of the matter is that because as we age, these discs get thinner and thinner, we can't really control the way that the tissue degenerates over time. But what we can control is the ability to use the muscles that surround the vertebra to actually stabilize those bones so that they don't move too much and pinch that nerve. Now, what does the bone narrowing and what we call stenotic activity look like? It actually looks something like this. it looks like little bone growths that start to narrow the canal. Now, as you can see, if we have bone surrounding that nerve, there's a lot less room for that nerve to glide in, and that's when the problems start to arise. So typically with stenotic activity, what you'll feel is that whenever you're either standing for too long, walking for too long, or doing any motion where you extend your back this way, you'll start to compress those nerves and you'll start to feel pain, okay? And that is one of the causes, one of the main causes, one of the main issues that we see here at Renewal Rehab. Now, the way that we target that, the way that we make sure that no one has more severe issues, and the way that we can get rid of those issues, like I said, is by working on all these muscles here that I'm about to show you. Now, typically when people think of the core muscles, we think of the 6-pack, 8-pack abs, and those are fine, but those aren't the ones that we target in physical therapy. In physical therapy, we target the deep core muscles, the diaphragm, the hip flexors, the iliopsoas, the pelvic floor muscles, right? We have the extensors. So as you can see, we have a lot of different muscles here at work, and that's why it's very hard, very, very hard for you to get better by doing random stretches and random exercises, because until we find out what the exact muscle that is affected is, that is weak is, then we can't help you get better. And the only way we know that is by seeing you here, by doing a full evaluation, getting a diagnosis, and actually coming up with a plan to solve your pain, your low back pain, okay? So that is the first issue that we come across, all right? The second issue are disc herniations. And basically with disc herniations, let me go ahead and get rid of some of this connective tissue here. Okay, so let me go ahead and hide this. Perfect. So, what's a disc herniation? So, what's a disc? Number one, a disc, as I said before, are these little white cushiony objects that you see in there. So, the disc is actually made of the annulus fibrosus, which is the outer portion, which is a thick connective tissue, and on the inside we have the nucleus pulposus, which is kind of like a jelly donut, okay? And what happens is that, like I said before, over time these discs get thinner and thinner, but not only that, I'm going to go ahead and turn this around. As you can see here, we have these things called ligaments, and these ligaments actually take a lot of load and a lot of stress over time. And these ligaments actually, what they do is they help protect, they're the first line of defense for our lower back. As you can see, we have, these are all ligaments here, these are all ligaments here, on the outside here, and this big ligament right over here is also another ligament that protects our spine. Now, these are all the first lines of defense. What happens is that over time, these ligaments can get weaker and weaker. And the reason that people aren't able to get as many corticosteroid shots as you'd like, and they limit it to 3 or 4, it's because those shots actually degrade the tissue and have the ability to potentially cause tissue rupture, which is not good. That's what we're trying to avoid. Now, as we age, we have elastin and collagen that make up the ligaments. As we age, those numbers of elastin and collagen start to go down. So already these ligaments are getting weaker and weaker, right? So as we put more load on these tissues, if we bend forward too much, if we put a lot of stress on those ligaments that typically recoil and are really good at coming back together, as we age, like I said, they get weaker and weaker. And not even as we age, but also as we put a lot of stress on there with improper movements that we do, whether we're placing a heavy load on our backs or placing a heavy load in front of us and then bending forward this way, over time that could lead to damaging the ligaments. And again, because they lose their elasticity, that first line of defense starts to disappear. So what happens when the first line of defense starts to degrade? Well, the second line of defense starts to kick in. And as you can see here, what that is that you see that green, you see that green ligament right over here? That is actually the second line of defense, right? And that second line of defense protects the disc from herniating. But the fact of the matter is that that can also, start getting weaker over time and lose its elasticity. So after that gets weaker, then that's when we're prone to getting disc herniations, disc bulges, and anything of that sort. So what does that mean? That means that whenever we have a disc bulge, the discs actually start to protrude a little bit. And again, because that starts to protrude, typically what will happen is it'll protrude on the two corners towards the back. So typically when we have a disc bulge or herniation, it'll be right out this way or right out this other way. Now, remember when I said that the nerves run through there? Well, typically with disc herniations, any sitting, any bending forward, any of those movements driving, those movements are what are going to cause pain, because as you bend forward, those disc bulges or disc herniations protrude outward and they pinch those nerves. So now it's very similar symptoms that can happen, but for a completely different reason. So the treatment is completely different, very different, at least in the beginning stages. So it's so important that you get diagnosed correctly so that we're able to prescribe the right treatment, okay? And that's a disc herniation. Now, this can also lead to muscle spasms. It could lead to pain, of course, dull aches, sharp shooting pains, numbness, tingling, shooting pains, all those things, burning sensations, and it can be debilitating. It can get really, really bad, okay? Now, the next and last thing that I want to show you, the third most common reason that people have low back pain and sciatica, is this one here. And like I said, this is not all-encompassing. There's a lot more that may be going on, and there's a lot more reasons for you to have low back pain, but these are the top three that I see, and that I believe most physical therapists see. So now, what I want to do is I'm going to go ahead, and as you can see, we have ligaments everywhere, but I'm going to go ahead and remove those ligaments, okay? And now I'm going to show you, the vertebrae here are connected to the pelvis. And the main nerve, the biggest nerve in the human body is the sciatic nerve. I'm sure you've heard of sciatica before. If you're not struggling with it, I'm sure you've heard of it from friends or family members. But basically, sciatica is this large nerve that comes from our spinal cord and down our pelvis, is the largest nerve in the body, and it also causes a lot of issues. It's really a pain in the butt, okay, quite literally. And whenever you have pain that's localized around this area, that's better than if you have pain shooting down your leg. As the issue, the injury gets worse, it starts to shoot down your leg even more. Again, and the symptoms that I described in the past, you may have the same symptoms, if not worse. Now, one of the reasons that sciatica happens is because we have this muscle, and we have several muscles, but one of the main irritants is the piriformis. And I'll show you what the piriformis is. So the piriformis is this muscle right here, okay? And when this muscle starts to guard, when it starts to get a little bit irritated, it can put pressure on that sciatic nerve. Now, why does that happen? For several reasons. Several reasons. One reason might be that we're always sitting nowadays and we're putting direct pressure on that muscle. And when you put pressure on a muscle, it actually relaxes, and over time it gets weaker and weaker. So in order to create stability in that area, it starts to tighten up and guard, irritating that nerve and potentially giving you those symptoms of sciatica. Okay, so that's one reason. Another reason could be that that because other muscles in your hips are weak or getting weaker, the piriformis has to overperform and overcompensate, and because of that, it may also get tight and start compressing on that sciatic nerve, and that might be another reason for why you have those symptoms going down your leg. So again, there's so many different variables here that it's very hard to figure out exactly what is causing it without seeing a physical therapist. right, without seeing your local health expert. So the fact of the matter is that there are so many different causes, and you need a specified plan, a specific plan to tackle the specific problem. Okay? So I hope that was helpful. If you have any questions, please feel free to reach out. There's a lot more that goes into this. This is not all encompassing, and really take this with a grain of salt in the sense that you need to speak to someone that can help you, a healthcare professional, someone that's been certified, that has a degree to help you solve this problem. Whether it's myself locally, or if you need someone that is not local to the Tampa Bay area, please feel free to reach out. I'm very well connected in the country and in the world with other physical therapists. So I'd be happy to connect you with someone that can help, and I'd be happy to do that for you. But all in all, those are the top 3 reasons for why people have low back pain. As I said before, stenosis or stenotic activity, disc herniations, disc bulges, or sciatica caused by piriformis syndrome or muscle imbalances in the hips. Okay? I hope that's helpful. I hope that gives you a better understanding of what may be going on, so you have a clear path and so you can make a better decision to go ahead and reach your local health expert to get some help. Okay? Now, as I said again, if you are local, if you are dealing with these issues, I would love for you to come in for a free discovery visit. 20-30 minutes, completely free, non-committal. If you're dealing with low back pain, if you have been dealing with low back pain, or you know someone who is, you don't have to suffer any longer. They don't have to suffer any longer. Go ahead, come into the clinic, get some free help. We'll figure out what's going on specifically. We'll come up with an action plan. And if we are the right people to help you, then we'll proceed. If we aren't, then that's okay too. We'll send you to someone who might be able to help you. Okay? So I hope you all have an incredible day. I hope that this was helpful. And if you found this valuable, go ahead and put in the comment section below, valuable. And again, I really appreciate your time, and I really appreciate you educating yourself on why you might be having low back pain. Thank you so much, and have an incredible day.